Let's get into how do you know if you have Hashimoto's. We look for symptoms and they can be local or systemic. Systemic means it's all over, and usually there are vague symptoms because Hashimoto's can move from a high thyroid functions to low thyroid functions. So locally, it's because of the chronic inflammation. Sometimes it invades into the surrounding tissues. So it can invade into the laryngeal nerve, or which supplies the voice box, therefore there's change in voice. It can compress the windpipe or the breathing tube, the trachea, and therefore some restriction in breathing. And sometimes pushes against the esophagus, which is the tube that connects the mouth to the stomach, and therefore has difficulty swallowing. But before difficulty swallowing, there's usually a lump in the throat feeling. So with other symptoms, because it affects every cell in the body, you can have head to toe symptoms. Brain health gets affected. You'll find that memorization becomes a problem. There are some balance issues noted. People cannot remember what things are used for, but they remember how to name them. Skin issues is usually due to destruction of the sweat glands and decreased production of oil or sebum. Therefore, there's dry skin, yellowish discoloration, thicker skin, coarse hair which falls off easily, brittle nails, very thin nails. There's no sweating because the sweat glands get destroyed. With the heart muscle, it becomes flabby and very difficult to pump, so you can have congestive heart failure. The heart muscle also fails to relax. The blood pressure, the bottom number goes high, so you have diastolic hypertension. Skeletal muscles, they become weak. They look much bigger. They are filled with the slimy fluid. That's why they look bigger, but they are much weaker. In the lungs, you have problems with breathing because of this obstruction in the windpipe and the trachea, inability to expand the lungs. There's increased fluid outside the lungs and weaker chest wall muscles. There's also anemia or decreased blood production because erythropoietin, a hormone that helps with the production of blood, is also low. There's low iron that's noted because of the menstrual abnormalities. Gastritis that causes low B12, destruction of the stomach lining is noted. The other effects are on the kidneys, therefore decreased kidney function and more water retention, so you tend to feel a little more swollen, miscarriages in younger years, and menstrual abnormalities with infertility. So you can see that the thyroid symptoms can be varied head to toe, and we'll get into how to diagnose with Hashimoto's, which is the next fun video.